Hello everyone, this is Yatisha Rajanala, and I'm going to present my Teach One topic titled A Machine Learning Approach to Early Detection of Sepsis in Hospitalized Patients. Firstly, in healthcare, data mining techniques such as classification, clustering, association rule mining, regression analysis, anomaly detection, text mining, natural language processing, machine learning, and deep learning play pivotal roles in extracting actionable insights from vast and diverse datasets. While each technique has distinct advantages, they also have unique characteristics that set them apart. Classification and regression analysis provide explicit predictions and are suitable for scenarios where outcome variables are known and well defined. Clustering and association rule mining, on the other hand, uncover hidden patterns and relationships within data, offering insights into complex healthcare phenomena. Anomaly detection is valuable for detecting outliers and irregularities, while text mining and NLP extract valuable information from unstructured textual data. ML and deep learning techniques excel in handling large and complex data sets, allowing for the development of highly accurate predictive models and decision support systems. By leveraging a combination of these data mining techniques, healthcare providers can unlock the full potential of data-driven decision-making, leading to improved patient care, clinical outcomes, and healthcare delivery. Healthcare data mining techniques offer a range of advantages across various domains of healthcare. Early disease detection and diagnosis benefit from data mining by enabling the identification of subtle patterns and risk factors indicative of disease onset, facilitating time interventions and improving patient outcomes. Predictive analytics for personalized medicine harness the power of data mining to tailor treatment strategies based on individual patient characteristics, leading to more effective and targeted interventions. Healthcare resource optimization is achieved through data mining insights that optimize resource allocation, staffing, and operational efficiency, ultimately enhancing healthcare delivery and patient satisfaction. Clinical decision support systems leverage data mining techniques to provide clinicians with evidence-based recommendations and alerts aiding in diagnostic accuracy and treatment decisions. Drug discovery and development benefit from data mining by accelerating the identification of potential drug candidates, optimizing clinical trial design, and predicting drug efficacy and safety profiles. Public health surveillance and disease prevention utilize data mining to analyze population health trends, detect early outbreaks, and inform public health interventions for effective disease control and prevention. Quality improvement and performance management initiatives leverage data mining to analyze healthcare processes, identify areas of improvement, and monitor key performance indicators, fostering continuous quality enhancement and patient safety initiatives. Overall, these techniques empower healthcare organizations to harness the wealth of data available to drive innovation, improve patient care, and optimize healthcare delivery at every level. To comprehend and delve deeper into such improved healthcare delivery, let us take the example of a particular case study that was published in the Journal of Science Translational Medicine in 2015. The study by Catherine E. Henry, David N. Hager, Peter J. Pronovast, and Suchi Saria for the Targeted Real-Time Early Warning Score, abbreviated as TRUE-SCORE for septic shock, aim to address the clinical need for accurate prediction of septic shock, a life-threatening condition associated with significant morbidity, mortality, and healthcare costs. With approximately 750,000 patients developing severe sepsis and septic shock annually in the United States alone, early detection is paramount to improving outcomes and reducing healthcare burdens. Previous studies had highlighted the importance of timely detection and treatment, demonstrating that mortality increases with every hour of delay in treatment after the onset of hypotension. While protocols like early goal-directed therapy had shown effectiveness, comparisons suggested that usual care may have been equally beneficial, indicating the potential improvements in standard care practices over time. The objective of the study was to develop and validate a predictive model leveraging machine learning techniques and electronic health records data to identify patients at high risk of developing septic shock before clinical deterioration occurs. Using this, the study aimed to improve patient outcomes and enhance clinical decision making with a reliable tool for risk assessment, the true score, and further address clinical uncertainty. The study utilized the MIMIC-2, that is, the Multi-Parameter Intelligent Monitoring in Intensive Care clinical database, which contains de-identified EHRs from patients admitted to intensive care units at Beth Israel Deaconess Medical Center in Boston, Massachusetts between 2001 and 2007. This dataset provided comprehensive information on patient demographics, vital signs, laboratory results, diagnosis, procedures, medications, and outcomes. The choice of the MIMIC2 database allowed for a large-scale retrospective analysis of real-world patient data, enabling the development and validation for the predictive model for septic shock. The data set encompassed a diverse patient population across different ICU settings, enhancing the generalizability of their study findings. In the study, the authors had adapted a retrospective analysis approach using the MIMIC2 data, where they had identified 16,234 distinct patients aged 15 years or older with relevant clinical assessments recorded in their EHRs. Patients were categorized based on systemic inflammatory response syndrome, SIRS criteria, and suspicion of infection to define sepsis, severe sepsis, and septic shock cases. The dataset was divided into development and validation sets, and they had employed a Cox proportional hazards model with lasso regularization to construct a predictive model for septic shock, along with addressing the censoring effects due to clinical interventions to ensure robust model performance by incorporating multiple imputation techniques. This approach had allowed the authors to identify the most relevant clinical features for predicting septic shock while mitigating the impact of overfitting data. The given formula was used to calculate the risk of septic shock at the time t with the given vital features of x. The baseline hazard function for each patient was multiplied with the exponential value of individual patient features and coefficients of the model with respect to time. The study demonstrated promising results in predicting septic shock onset using the developed true score. The study reported sensitivity, specificity, receiver operating characteristic ROC curve, and area under the curve AUC of the predictive model, indicating its discrimination ability and predictive accuracy. Additionally, the other performance metrics were analyzed, such as positive predictive value (PPV), negative predictive value (NPV), median time before septic shock onset, and proportion of detections before evidence of organ dysfunction. These results provided insights into the early detection capabilities of the true score and its potential clinical utility. Furthermore, the results of the true score performance was compared with existing prediction models or clinical guidelines, highlighting its advantages and areas for improvement. The true score had demonstrated superior predictive accuracy with an AUC of 0.83, significantly higher than the modified early warning score (MUSE), which had recorded an AUC of 0.73. Additionally, TrueScore had achieved a higher sensitivity of 85% compared to the routine screening's 74% and had a slightly better specificity of 67% versus the routine screening's value of 64%. Notably, TrueScore was able to identify patients at risk for developing septic shock with a median of 28.2 hours before the onset, a clinical advantage for timely intervention, which was not quantified by the other methods. These results thus highlighted TrueScore's enhanced performance in early detection and had underscored its potential to improve patient outcomes in clinical care settings. The strengths and limitations of the TrueScore were considered using factors such as its predictive accuracy, generalizability, and potential impact on clinical practice. This had shown that the TrueScore enhanced early detection of septic shock by leveraging machine learning techniques on EHR data, enabling personalized risk assessment and tailored interventions based on dynamic changes in patient parameters over time. It seamlessly integrated into clinical workflows, streamlined for real-time risk assessments in ICUs, while broadening its applicability across diverse settings and populations, which had enhanced its potential impact on improving patient outcomes. However, the TrueScore's performance was only contingent upon the availability and the accuracy of the EHR data. This posed challenges when the data entries were incomplete or inaccurate, which potentially compromised their predictive accuracy. Although promising results were demonstrated within a single medical center, the model's generalizability to diverse healthcare settings and populations varied, which necessitated careful validation in external contexts. Furthermore, clinical interpretation and implementation of TrueScore outputs required validation and understanding by healthcare providers, alongside addressing ethical and legal concerns regarding patient privacy, consent, and algorithmic bias to ensure responsible deployment in clinical practice. So, these were concluded as the prospects of further development of the study. To conclude, this is about the study review that I had done as a part of my Teach One assignment, and these are the references for it. Thank you for your time, and I hope that this presentation has reflected the data mining techniques that were used in the study. As we embrace the future of healthcare, let us continue to harness the power of data-driven insights to pave the way for a healthier and more resilient society. Thank you.